My name is Norm Volsky, your host, and this is the Digital Health Heavyweights Podcast. Hello, welcome to the Digital Health Heavyweights Podcast with Norm Volsky. And today my guest is Manny Menendez, former Chief Commercial Officer over at ConsumerMedical, which sold to Alight, among many other stops in his career. Welcome to the show, Manny.
Norm, thanks for having me. Pleasure to be here today.
Yeah, no, it's going to be a good day today. July 4th is coming up, so got any fun plans for that?
A lot of golf and cooking out is what we do here in Chicagoland.
All right, well, you'll work up a sweat in the ring with me today, and then you'll eat the rest of the week, which is great. So, how's everything going with you?
Things are great. It's very interesting times in our industry, but when there's challenges, I always view there's a lot of opportunities. So things are going really well.
That's great. You're an optimist at heart, which I love about you. So I'll jump into the questions. You've been in the benefits and health plan space for a very, very long time. How did you find your way into the health insurance business? Very early in your career.
Yeah, I've been at this, I counted in decades now. That's how long it's been. So it's been over 3 decades.
Okay.
So back in the really late 80s, I was coming out of college, and in 89, the job market wasn't so hot then. Mm-hmm. And so I was looking at 2 different.
What was inflation back then? 25%?
Very, very, very high. Let's just state it there. Leave it there. So back then I was looking at really 2 career paths. I was really interested in banking, either commercial and or investment banking. Mm-hmm. And then I always was interested in insurance and employee benefits. And so during the summer of 89, I spoke with a lot of different entities, and I got 2 offers, and I kind of stumbled into insurance and benefits, to be quite honest. The offer that came in first, 10 days first, was from a company called CNA Insurance Companies, mm-hmm. which is a very large property casualty insurer that's owned by the Tisch family out in New York. Back in the day when they were actually in group benefits, actually they were in healthcare back in the late 80s into the 90s. So that offer came in, and then a banking offer came in about 10 days later. But I had already accepted the benefits insurance offer, and my dad said, "Your word's everything." Yep. So I had to stick with that, even though I was very intrigued by this commercial banking offer. I stuck with my original commitment and got into insurance with CNA Insurance Companies.
Well, I and many in the industry have your dad to thank for giving you that advice. So I'm glad that you listened to him. So what kind of inspired you to work in healthcare, other than your dad kind of forcing you into it?
Yeah. It's interesting. I've always wanted to be one that can help others. I really inherited that from my mother. She was a very kind, giving lady and always taught me to help other human beings. And the more I got into insurance and I got into group benefits and then healthcare, I really saw that, there's a lot of things that were working, but obviously a lot of challenges within. And early on, I saw that when you can help people create programs that benefit individuals and their families, the impact you have on them is immeasurable. And that really stuck with me early on. And I just really love the fact that healthcare is so personal. And guess what? Everyone in their lifetime will experience healthcare. Yeah. And so that really inspired me through my career, a lot of different junctures, which I'm sure we'll get into today on this discussion. But it really inspired me to continue to move forward and continue to help people, organizations, in whatever way possible to make sure that they got the most appropriate and the best care possible when they were dealing with whatever they're dealing with.
Yep. And from CNA, you eventually found yourself to Hewitt and Associates, right?
That's correct. Yes. In actually, a little known fact, in August 28th of 2000, which happened to be my birthday, was my first day as a consultant at Hewitt Associates back in the Y2K days, for those folks that remember those days, and spent 11 great years there. Really met some of the smartest, motivated, brightest individuals. But of the many things I took from Hewitt, one of the neatest things about my 11 years there was not only the employers I got to work with, because really some great employers doing great things when they think about healthcare and broader benefits and the positioning of total rewards. Obviously, so critical right now with what we're
Hmm.
seeing with human capital and unemployment. So all that was quite rewarding. But the neatest thing for me was the culture
Yeah.
at Hewitt Associates back in the day. And I'll give you an example because everyone talks about culture. But an example was this was back before you could actually work from home. Most of
Yeah.
us didn't even have a laptop. We had hardwired desktops. And at Hewitt Associates, oftentimes, people be leaving 6:37, and if they walk by your office, they would stop, peer their head in, and say, "Manny, is there anything I can take off your plate so you can go home too?" So it
Hmm.
very much was an environment of team, not I. And that culture, I never thought I'd run into the culture again. I did later in my career because I've been
Yeah.
very fortunate. But to me, that's one of the strongest thing I took away from it is the culture and the respect for your colleagues, and we call them associates at Hewitt.
So this, was from 2000 to 2010, 2011.
Hmm.
And in that time, I'm just curious, current benefits brokers and consultants, as well as even benefits managers specifically, are experiencing point solution fatigue. They're seeing
Yep.
so many new software solutions pop up. What was the environment like back then in the 2000s?
Yeah, no, it's interesting because I was reflecting in anticipation of this conversation. And
Yeah.
one of the things I'll start with is cost, right? Because every employer, every broker, consultant, individual thinks about the cost of healthcare. Back in 2003, the per employee per year cost for medical and prescription drug, that combined premium equivalent or fully insured premium, was $2,300.
Okay.
$2,300. Generic utilization rates were sub 30%. Now they're broaching 90%, right?
Mhm.
And so a completely different environment. And then the other thing I would share with you, everything was carved in, right? The payer really managed all these different, there's over 10,000 of these digital solutions out there, the latest research I saw. And
Mhm.
at that point in time, everything was carved in. And the big thing was around PPO plans, people moving away from indemnity to PPO to point of service and HMOs, right? For
Mhm.
that healthcare being delivered locally. So a lot of the time back in the 2000s in that decade was all around choice and giving people the appropriate choice to meet their individual and family needs. And then toward the end, it started to be an eye toward cost. Because again, I gave you that 2,300 number in 2003. By 2010, toward the end, it was 9,000. So we were
Yep.
seeing an
And it's
escalation caused by
steadily
many
increased
factors, right?
since. Yep.
But again, that was the high level environment back then.
Do you think any health plans have grandfathered in any of their top customers at that $2,300 a month, or you think they've just steadily increased?
I don't believe anyone's grandfather at that point because
Yeah.
we always used to joke back when I was a consultant.
Yeah.
Most of the organizations I worked with were larger market. So Fortune 500, I did work with some in the 5 to 10,000 employee space, but that was the ASO market. So we always joked at that point in time, guess who the payer was? The employer, right? They were writing
Mhm.
the check. The health plan payer health plan was the facilitator for the managed care network, claims processing, et cetera.
Mhm.
But yeah, I think anyone would take back those days in a heartbeat with those type of cost levels.
Definitely. So you spent 11 great years at Hewitt. It sounds like it was a great culture, great experience. What compelled you to get that first entrepreneurial itch to go over to Bloom and, tell us about that?
Yeah, so I think it was late 2010. Hewitt was acquired by Aon, and at that point in time, great combination, two really excellent firms. But I always had this itch
Mhm.
to go build something, right, and to help people in a different way. Like I mentioned earlier, helping human beings. And so my mentality and thought process was I never want to look back 10, 12 years from now, 15 years from now. This was in 2010 timeframe and
Mhm.
say, what if, right?
Yeah.
I want to go try to build something. So I got presented this opportunity with some industry colleagues and friends that had gone over to Bloom Health to go join them in a growth business development capacity.
Mhm.
And so I went ahead and did it. And at that point in time, that was the environment that private exchanges, the post 65 retiree exchanges have been around, but the group active private exchanges were coming into mode at that point in time. And that's what Bloom Health represented, a group active exchange. So I was
Yep.
very intrigued. I thought it was a great way to offer what I call facilitated and supported choice for the
Mm-hmm.
individuals to look at the different trade-offs from a design, from a price, all the different things that went into a private exchange. And so I jumped at the opportunity and joined Bloom Health. I believe it was in January of 2011.
What did the vendor community look like at that point? Like, what were even the other vendors that were, either competition or at least fighting for the same dollars back then?
Yeah, when you look at the group active, there's two that really jump to mind, and others came into the market. Liaison was
Okay.
one that
The
ended up
Willis
being
spot.
that Willis bought. Correct, Willis Towers Watson purchased was one. Trying to think who else was in the Mercer Health Marketplace came into vogue a couple years thereafter. Aon Hewitt had developed the Hewitt piece, and obviously became Aon Hewitt.
Hmm.
Had developed a differentiated exchange. It was more of a fully insured, a managed competition model.
Yep.
It was kind of one of the early entrants, if you will. And so
Hmm.
those were kind of the main players. Over time, obviously, everyone came up with their own version of a group active private exchange, but those were the early entrants back in 2011, 2012.
And like, what other vendors were out there? Like, whether they be wellness vendors or, I don't think chronic condition was really a surface that anyone had,
Yeah, I think,
came to.
back in that day, again, point solutions had not taken off. So think
Hmm.
of the environment now with these 10,000 different point solutions out there trying to compete for the benefit dollar. At that point in time, it was basically a carve-in approach.
Uh-huh.
Some of the categories that were pretty hot were disease management, right?
Uh-huh.
Ended up being called condition management, morphed into medical management over time. It was wellness, right? What are you doing to stay well? Not well being, the broader interpretation and
Uh-huh.
definition we see out there today, but it was more of a physical wellness. Are you getting your annual physicals? Are you getting the appropriate screenings, to stay
Mhm.
well and not become, manifestation of a condition, for example? So those were kind of the main buckets. Obviously, the traditional players with, the PBMs were much broader, right? They weren't
Mhm.
all consolidated as they are today. It was pre-collaborative. Right now, they have all these different RX collaboratives that help purchase pharmacy on scale. That was not there. And then obviously the traditional um, group accident, life, disability, and voluntary benefits were really starting to take off as well. And that was
Uh-huh.
another big category that was doing quite well back in that day.
What was the team like at Bloom in the early years? Like, who was the team that you joined that you were familiar with, and like, what was the core group?
Yeah, the core was a couple gentlemen out of the St. Paul, Twin Cities, Minnesota area,
Mhm.
and they were entrepreneurs by nature, and they had this vision to again build that choice model for the individual employee on that exchange chassis. And so there are three founders: Marek, Kabir, and Jill were the three main founders, all coming from different backgrounds, but all very focused and motivated individuals. So what they did is they went and started to recruit, and this is one thing that I think is so critical of any early stage solution. They went to start to recruit industry veterans, right?
Uh-huh.
Get people from the industry that understand the employer community, understand the advisor brokerage community. So they recruited a few individuals who in turn recruited me to
Mhm.
join the team. And what I liked about it at that point in time is we were all like minded, very mission oriented. We all wanted to build something that was differentiated. What we went in to do kind of changed over time because at
Yeah.
early days, the Blue Venture Fund was an investor in Bloom Health. And then I think it was 6 months after I joined, three very large blue entities became controlling interest in Bloom Health. And we
Mhm.
ended up being the technology behind their version of a private exchange, and we help them sell their version of a private exchange around the country. But again, the team was like-minded, and what I did like about it, very similar to Hewitt, is it was team, right?
Uh-huh.
What I learned in the early days of moving to, that was really a startup because we were before the proof of concept
Mhm.
stage. And what I really learned is when you go into that, you have to roll up your sleeve. Doesn't matter what your title is. It's all hands on deck. And you
Yep.
have to be very resourceful to be successful.
Okay. What were the biggest challenges you experienced over at Bloom? Because that was one of the like first early stage startups kind of in this market.
Yeah, I think the major challenge was market awareness and education, right?
Hmm.
Everyone had heard what, we're aware of private exchanges, but we always used to joke back in the day, you've heard of one private exchange, you've heard of one private exchange, because there's so many variants of what was considered a
Hmm.
private exchange. So our major challenge, and quite frankly, again, opportunity, was what's this version of a private exchange? What's the front end decision support tool? And then what's the back end benefit administration that supports it? And how
Hmm.
does the front end from a decision support plug into the back end, if you will, for a seamless experience, not only for the consumer, i.e., the employee, but obviously the employer themselves as a sponsor of the program. And so that was really some of the, again, challenges and opportunity. We had 3 different very large Blue plans we were working with. And obviously, as folks know, the Blues are more of a franchisee approach. So 3
Yeah.
meant 3 different programs to plug into. But the opportunity was we had the great membership to sell into all their existing groups. And so we were very fortunate to have a captive audience, if you will, with these respective Blue plans to go out and share their version of a group active private exchange.
What were the accomplishments you were most proud of in your time there?
We were able to create the education and awareness. And I start
Mhm.
there because that's the most important thing. The problem we're trying to solve for is support these employers and their employees with making informed decisions that meet their individual needs, right?
Yeah.
Healthcare is very personal, and we all have different insurance coverage and benefit needs. And that's one thing that a private exchange was able to do. And so I was proud of that. And I was also proud of the fact that we were able to enter the market and have some
Mhm.
really solid compound annual growth rates of over 25%.
That's good growth. Really nice. What did you learn from your time at Bloom that, helped you later in your career? Maybe at Consumer.
Yeah, I think a couple different things. I mentioned one is resourcefulness, right?
Uh-huh.
Coming from a large consultancy, we have intellectual capital that you just have to
Mhm.
know how to read, and it's right there for you. Again, going to a smaller entity, you have to be quite resourceful to figure out what's happening in the industry. Application at that point in time, ACA, Affordable Care Act, had just come out,
Mhm.
so the different applications there. But the other thing I would share is intestinal fortitude,
Yeah.
right? In early stage companies, you're going to take your lumps, you're going to take your bumps. And I would always encourage people never get too high or never get too low, right? Try to be
Yeah.
steady state because we always used to joke this is a marathon, not a sprint. We're trying to
Uh-huh.
build something here that's differentiated, and we're not going to do it overnight. We're not going to do it in 1 year, 2 year. So always do the right thing. And then the other thing that was really critical is to make sure that what you sell to these groups that you deliver on that promise. Because again, if you don't deliver on that promise, it's going to be really hard to scale a business if you're
Mhm.
not maintaining the groups that have signed on already.
I think my team is going to think I paid you under the table to say that. I say very similar things to my team, and kind of how
That's
we've
awesome.
scaled over here, and kind of how we think about the business, which is great. In terms of like eventually you went over to consumer, talk to me about that. What about that opportunity really stuck out? I'm sure you had plenty of options, and that
Yeah.
was just one of many. And ultimately, like, who compelled you to come over to consumer?
Yeah. So I spent, let's see, about 4 great years at Bloom Health, 2011
Yep.
to 2015, toward the end of 2015, I believe it was. And great run, right? Really enjoyed it. And it kind of got me out there, right? That, hey, I can do this. I can build things with
Yeah.
like-minded people and had great fun. But at that point in time, it was somewhat saturated. It was time for me to move on. I did spend about 17 months at the Legacy Towers Watson. So
Mhm.
pre-Willis days. Actually, when I was there, I think this is what happens when I go to consultancies. Willis acquired Towers Watson. So but spent great
Oh man,
17
Mercer
years.
should just scoop you up because they could be some type of target to someone at some point.
No doubt. But yeah, great people there. Really enjoyed working with the team there, doing some strategy work for their central division. But what was missing for me is that entrepreneurial side again.
Mhm.
That I got a little taste of it. I really enjoyed it, and I'd been in some conversations with one dear industry friend, Kevin Kekafer, and he had shared that he had joined this company called Consumer Medical.
Yep.
And he kind of started explaining what consumer medical was with respect to clinical advocacy, second medical opinion, and the mission orientation of what consumer medical represented
Yeah.
was off the charts. I just really appreciated their orientation toward trying to help each individual get the most appropriate care by
Yep.
providing the health literacy. Health literacy in this country is south of 10%. Most folks aren't trained as clinicians, and CM was filling that void to really make sure people were educated. They had some really large Fortune 100 logos as a
Yep.
really small sub 10 million ARR company. So it's
Uh-huh.
quite impressive. I got introduced by Kevin to David Hines, their CEO, and just top notch human being, quality individual,
Mhm.
really as a founder in it to make a difference
Yeah.
for people to make sure they got the most appropriate care. His origin story was a personal one, and it was his lifelong mission, and ran that company for over 25 years. But those factors really compelled me to say, wow, this is something that I think has opportunity in the market, number one. But most importantly, was the people. I got to meet a
Mhm.
lot of the people and just top notch, reminded me, quite frankly, a lot of the Hewitt folks, a
Yep.
lot of the Bloom Health folks. And again, that's kind of the litmus test for me is what are the people like? What's the culture like? So I had good fortune to join there. Early days, first couple of years, I built out their channels. I was the
Mhm.
head of their channel, and then I eventually went into the chief commercial role. And we were just so blessed there to have a great solution that had impact, number one.
Mhm.
Number two, let's be honest, timing does matter. And there is
Yep.
some luck involved in this. And at that point in time, if you look back at the industry, employers are really focused on providing that clinical advocacy, that clinical education to their folks
Mhm.
so they can make the right decisions for themselves and their loved ones. There's a lot of able competitors, as a lot of folks are aware in the second opinion space. We were in that space and we were able to carve our niche through direct to employer sales and some key health plan partnerships.
Mhm.
We're really able to scale the business in a tremendous way. I believe over the last 4 years, I had a 6 year run there. Collectively, the team averaged just south of 40% compound annual growth rate. And so we were
Wow.
really proud of that. And I accentuate team because it
Uh-huh.
wasn't just the business development team, it was the account team, the clinical team. It was a group effort. We were a small endeavor about,
Mhm.
toward the end, we were about 200 FTEs.
Yep.
In my early days, we were about 50 FTEs. So small teams stuck together, but made a huge impact. Really
Okay.
rewarding.
Love it. That's really, really great. So 25% growth at Bloom, 40% growth at Consumer. Whatever you do next, it's going to be in the 60s.
Well, let's hope so. The
The
bar's high,
trend.
right?
Yeah. How long do you and Kevin go back? How long have you known each other?
Oh, I knew you were going to ask me that. So it was back in my Hewitt days.
Okay.
He was a representative at Cigna at the time, calling on me, large
Okay.
market. And I was fortunate to work with him and ran some RFPs, and he won some nice pieces of business. And I says he won because they did all the great work. I was just
Yeah.
evaluating everything, and
Uh-huh.
just like-minded individual, top-notch quality human being for folks that know him. They would agree unequivocally with me, and we forged like this business is so great. Like many of the people in this business, we forged friendships, right?
Yep.
Lifelong friendships. We always used to say organizations come and go, friendships persevere, and
Yeah.
Kevin's definitely one of those individuals.
Well, I can say with confidence, you're definitely one of, if not the most popular person at conference board every year. So
Thank you.
you got a posse that follows around. So
A lot of good, a
it's
lot of
nice
good
to
people out
see.
there.
Nice to see. Um, in terms of what you said earlier, where like the mission is what attracted you to the business. I don't mean to, bring up a competitor of a former competitor of yours, but in the first episode we did with Michael over at EHIR, he mentioned, during his scaling of EHIR that, his wife, was diagnosed with cancer. And, he actually had like a golden ticket, so to speak, from the Grand Rounds folks at the time. So, you know, it, whether it was you guys or Grand Rounds or Second MD or Best Doctors or Advanced Medical or a handful of these groups, I have friends who came from all of those family trees.
Mhm.
It's just amazing work to give people access to a level of care that, might not be covered by their health plan. Sponsored by the employer at cost effective rates is, just an amazing business. And I know there are a lot of differentiators, at each group. But, I think it's just an amazing category, that brought a lot of value, whoever you ended up choosing. When you started at Consumer, like how many of those competitors were already established and how many, kind of popped up a little later?
Yeah, when I look back on it, I would say probably the early innovator in the space, if I recollect correctly, is Best Doctors, the
Hmm.
legacy Best Doctors that Teladoc acquired. And then the organizations that were kind of coming along with Consumer Medical was, Second MD, as you mentioned, Advanced Medical, again,
Hmm.
another entity that Teladoc bought. Those were kind of the top four in the early, what
Okay.
I'll call the early days. Now there's a lot of health systems doing the second opinions, what have you.
Yep.
But those were kind of the major four. And I thought it was great to have the competition, right? Because we were all
Yeah.
like minded from a category. And when a
Hmm.
category is doing good, that's good for everyone in the category. And you mentioned one thing that CM started early on. I give David Hines credit because, again,
Yeah.
he was in this 25 years back in 1996.
Hmm.
He started our version of the Golden Ticket program,
All
right? The
right.
Gold,
So
Golden
maybe Grand
Ticket.
Rounds got that idea from someone else.
Well, back in the day, Grand Rounds was a partner of Consumer Medical. If you go
Okay.
way back as a remote expert opinion partner, so there is some history there between the organizations. But I bring it up because I think a lot of them ended up doing it. And the great thing about the Golden Ticket program was, if you had a friend, family, or loved one that needed help and you didn't have the service, Golden Ticket was a free use of the service from beginning to end.
That's incredible.
And the impact you had on people and what we called the thank you letters.
Hmm.
We would get thank you letters right and left, not only from the Golden Tickets, but from our employer groups. And
Hmm.
what we would do, and this was the rewarding side of the mission orientation of the business, is how
Yep.
often as a benefits leader do you get a thank you? So what we would do is we'd take these de-identified thank you letters from all the participants, and on the 3-year anniversary of being with Consumer Medical, we'd give them a coffee table sized book of all
Uh-huh.
the de-identified letters.
Oh,
And they're
that's
usually
fantastic.
at the end of that meeting, after that book was handed out, there wasn't a dry eye in the room. You started reading through, wow, helping people with the most difficult life or death situations, oftentimes,
Uh-huh.
and getting some of the best advice from the leading experts around the country through these second opinion services really did make a difference. So I wanted to bring up that golden ticket because it's such a great program.
Yeah. I really enjoyed that story. What were the major challenges you experienced at Consumer? I know you guys had a lot of success, but I'm sure there were challenges as well.
Yeah, I think anytime you're trying to scale a business, it inherently comes with challenges, right?
Mhm.
You have a lot of different factors that need to line up. And it's great to, come on here and talk about the 40% CAGR rates, which were there, but obviously you have to deliver on it and making sure that you can get the right abled client success folks to lead the endeavor, which we were blessed at CM
Yeah.
to really have some great folks when I joined and add some additional folks was really critical. Technology, right? Getting the right platform to keep up with the advancements and the coordination and integration with all the different flow of records and what's needed with second opinions
Mhm.
was a both a challenge and an opportunity. And then, quite frankly, it's also education and integration with all the payer community. Right? Here's our
Mhm.
swim lane. Here's what we're doing. We're not trying to get into the medical management on all the supply side clinical navigation services you folks are doing so well with. We're sitting on the demand side, trying to
Yeah.
provide that education before the service is actually rendered. So coordinating all those things were quite critical. And again, it gets back to market awareness and education. The
Mm-hmm.
consumer medical service was a touch different because we had a little broader service beyond the second opinion to more of a clinical advocacy, which is a more in-depth service to walk individuals through what they're dealing with, their different treatment options, modalities, including a second opinion. So it's a little bit more in-depth. So explaining why our service was a little bit different.
Mm-hmm.
And then the final thing I'd mention, and it needs to come up, right? It's the economic value, right?
Yeah.
Because at the time, again, we're into 2016 into 2022. Everyone was looking like, what's the return of investment or on investment? In this case, the return of investment was really, we created a really targeted program. We called it surgery decision support.
Mm-hmm.
It's a preference sensitive elective category of back, knee, hip, hysterectomy, and bariatric. Again, preference sensitive is alternative modalities to get well. What we'd be able to do is consume data on the last 3 years of what the employer had experienced in those 5 procedures, and then demonstrate with our program with certain engagement rates, utilization rates, and then conversion rates.
Yep.
Once you have an educated consumer, they're not always going to go down the path of back surgery because literature shows it works less than half the time. They're going to go elsewhere. We were able to demonstrate that at minimum, it was a 1-to-1. You get your money back, but with other levers, with incentives, some heavy orange sticks, we called them.
Yeah.
We were able to get 3 to 4-to-1 return on the money invested from a PEPM. So again, it was challenged early on, but as we built that out and could demonstrate the economic equation, and then it spoke for itself. And then the final thing that I would share as far as, again, challenge going into an opportunity, it's very much I'll call it a strategic sale, because you have to be able to illuminate, articulate, how does this second opinion clinical advocacy service fit into the broader strategy that we're trying to convey to our people?
Yep.
And so connecting all the pieces from the health plan to what we did to the benefit administrator, et cetera, was again very critical to make sure it was a seamless member experience.
Great. So I'm gonna say a bold statement. I'm not just saying this because you're on the show. I say this when we're not on a podcast. And just for listeners, real quick, 3 to 4x ROI is very large for this space. So that's a very key statistic that I took note of, and I just wanted anyone listening to know that. So the bold statement I'm going to make is I think you're one of the top commercial leaders in this space. I think from a commercial go-to-market strategy standpoint, there might be only a handful of folks, that have similar experience to yourself. So I'm going to ask this question in the context of you taking 2 companies and kind of creating a new market category, whether it be at Bloom or whether we, was at Consumer. So, a lot of the people I know, a lot of the people potentially listening to this podcast are early stage founders that are trying to bring a new solution to market that hasn't existed before. They're trying to create a new market category. What type of advice would you give that person in how to create a new category from essentially scratch?
I would say number one, have a very solid origin story. Why do you exist, right? I always start there because I think if you can't articulate in 45 to 60 seconds your origin story, which should convey the problem that you're solving, I think it's going to be very, very hard to get traction in any market. Now, let's talk about the commercial market where I think it's 170 million Americans get their coverage today. So having that origin story, I think, is absolutely paramount and critical. That's point one. Point two, I think part of the formula that works really, really well, and I've been fortunate, is surround yourself with great people, right? As a leader,
I can wholeheartedly agree with
you. Yep. And I'll tell you a story. I had 6 business development representatives at ConsumerMedical. 4 of the 6 now post ConsumerMedical days are chief growth or chief commercial officers at other companies. That's not me. That's great individuals going on to do great things. So surround yourself with great people, right?
And I can attest, some of those people are great. And the ones that I'm saying I'm not sure are the ones I haven't met yet.
Yeah, there you go. Intestinal fortitude, right? It's going to get bumpy, but the passion and the belief in your mission and what you created, needs to be there. And then the final thing I'd share, and this is storytelling, right?
Hmm.
Don't tell me all the data statistics on what you're doing. Tell me a story. Tell me a story on how you're making good and impacting people
Yeah.
with the service that you're providing or the product that you're providing. Hopefully, it's more of a service solution based, because the research shows stories are 7 times more powerful. And being in the clinical advocacy second opinion category is really easy to tell compelling stories. But whatever category you're in, I'd really strongly encourage you to leverage the power of stories, because people remember stories when you leave the room. People will not remember all the data and statistics you've shared with them. So those are a few tidbits I'd encourage founders to focus on.
I think that's great advice just for any founder, any salesperson, anyone who, is trying to increase their influence, whether it be personally or professionally. Like that is master's level stuff, which I believe you have a master's program at Northwestern, right? That you teach at?
Yeah, so I don't teach at Northwestern, but there's one of the I have a small advisory firm now, and
Yep.
one of the entities I'm a partner 1099 into is a company called Sales Engine,
Yep.
and Sales Engine's around human performance and helping make people make progress in their life. Think of getting an MBA in sales. And Craig Wertman was the founder, incredible human being.
Hmm.
He's a clinical professor at Kellogg. He founded the Sales Institute, and Sales Engine is the commercial arm of the Sales Institute. So I have the great fortune now of trying to spread the wealth of human performance and business development and getting a master's over a
Yep.
curriculum of 15 courses. And the cool thing about it is it's across all SICs because it's not specific to an industry.
Yep.
It transcends all industries. So a little bit of the
Well,
work I'm doing right now.
our listeners are very lucky. That is master's level advice and strategy from one of the best to do it. So I would agree. Like the team you built at Consumer and several places in your career have just been top notch. I'm impressed. What advice would you give sales leaders on how to hire great people and how to attract them and how to, you know, have a high success rate of hires to folks that actually perform in the job? Like what are the things you look for when you look
Yeah,
for sales talent?
yeah, I think it's a really important question. Given, I mean, more more than anyone right now,
I don't
Norm.
know
The
about more than anyone, but I'd like to think
well, the
I'm educated on the subject.
Yeah, the demand supply inequity right now, the demand of great sales and commercial leaders far exceeds the supply, and I think
Hmm.
you can validate that. So what I'd encourage people to look for in great business developers is people that fit the culture. I've
Yep.
mentioned the culture word a few different times on this discussion today, but I think that's so critical because
Mhm.
culture leads to a lot of great things. And the first thing is, are they aligned with what the mission of the company is? Do they believe in the product, right? And that's first and foremost. That would be the number one question our CEO and founder at CM would ask.
Hmm.
Why do you want to join Consumer Medical? If it wasn't about the mission, then you probably weren't a good fit. So I'd really, really focus on the culture and the mission. Um, the other thing I think is really important is there's so many different solutions out there is try to get people with experience, right? I know
Yeah.
that that's kind of, no, that's kind of an obvious one, but the business model that we had at back at CM, 6 people, and our competitors had 24, 26. They had a lot, but our
Hmm.
orientation was across those 6 people, 150 years of benefits experience. And so our
Wow.
orientation was the more and more digital health starts expanding, which it's taken off, as we all know, is being able to articulate the strategic fit of whatever the category of service it
Hmm.
is, digital health, within what a commercial employer is trying to accomplish with their benefits total reward strategy
Yeah.
is so paramount. And so I think looking for people that have a bent toward experience, strategic mindset, and then obviously a connection within the community. The other thing oftentimes I look for is just understanding people's comfort levels in selling in different segments. And what I mean by
Hmm.
that is direct to employer, right? Going right to the employer, working through the broker advisory channel, very critical. And then ultimately through other partners like, platforms or health
Mhm.
plans. And so I looked for very diversified candidates that were comfortable, not just in one of those categories, but
Mhm.
transcend all those and had experience or were willing to take the shot at doing that. And then the final thing is those that always wanted to earn 2 to 3x what their base salary was, because those are the type of people that are hungry,
Mhm.
passion. One side note that I'd find, and I just stumbled into this, this wasn't something that, I knew, but I've had several former high school and college athletes work for me,
Okay.
and they have the belly, the fire in the belly, and they're
Yep.
they're competitive. And so it's hard to measure in an interview, but those folks ended up being some of the best performers I've ever worked with because of that competition. They didn't like losing.
Yeah. Well, I guess I'm the exception to that rule. I wasn't a very good athlete, but I'm pretty good at what I do. So, there's exceptions to
Absolutely.
everything. But in terms of what you mentioned, from your perspective, you're like, oh yeah, I made sure bets. But like just looking at the people's backgrounds that you hired, and I know they were ultra successful, but the success rate of pulling someone from a carrier or from a big consulting firm and into a digital health company and becoming successful in a much smaller size company is actually pretty low. Like that's in my opinion, and not just me, like through
Mhm.
experience,
Yeah.
through, kind of doing a lot of intelligence and asking around in data, like those people tend to be the riskiest. So I'm just wondering, like, you've worked in big companies, you've worked in small companies, you've been successful in both, the people you've recruited have been successful in both, but that's not usually the case. Like a lot of times some people working in a big company can't work in a small company and vice versa. So I guess like specifically within digital health, within this kind of software space, what makes someone successful in both environments? What are the characteristics that allow someone to make the transition from top person within a carrier or a benefits consulting firm and then also really successful in a company that has, a lot less name recognition, a lot less resources?
Yeah. Words that come to mind are autonomous,
Mhm.
independent, resourceful,
Yeah.
not hardworking, meaning not afraid to roll up your sleeves. You may be a senior partner at one of these large benefit consultancy doing great work there. But when
Mhm.
you come to the front line of some of these digital health, you could have a big title there, chief commercial, whatever the case is, but you're going to have to roll up your sleeves and make it
Yep.
happen. And really, and I say that because a lot of these large institutions have checks and balances, right? A lot of the red
Mhm.
tape and what they do to make themselves successful because they are so large. They need to have all those checks and balances. Oftentimes in digital health, at least what I experience,
Yep.
is what's our policy on X, Y, or Z? We don't have one. Let's make it up, right?
Mhm.
And then run it through the executive committee, of course. But a lot of it, again, is you're forging the ground, and you have to be resourceful and a go getter, right? It's not going to come to
Mhm.
you. Final thing I'd say is being extroverted with respect to not being afraid to reach out to others, to market the
Mhm.
solution, be out in the industry. A lot of the folks that I've had great fortune to work with are great, way better business developers and marketer than myself. They love it. They're out there. They're
Mhm.
on things like LinkedIn. They're at these conferences. They're on the stages. And again, that takes a certain type of individual that's not afraid to put themselves out there. And then the final thing is, don't make the jump from that large institution if you don't believe in what this organization is doing. And I always
Yeah.
say interviews are two ways. They're interviewing you to see if you're a fit, but you interview them and have them sell you their product or service or solution, right?
Yeah.
And can they convince you? And then the final thing I'd mention, I think this is really, really important. And this was taught to me early in my um, startup, early stage company career, is if someone's not working out for whatever reason, you got to manage them out quickly. Because the
Okay.
smaller the entity, the um, more impact in not a good way that individual could have. So you can't be afraid to manage folks out if they're not cutting it. And
I'm
I think
definitely gonna
quite frankly, what I'm seeing now as more and more with some of the pullback in the venture capital from 21 to 22, I think more and more organizations are going to be held accountable for the value inherently
Mhm.
being driven or not. And so you're going to have really good people to help drive that value.
Couldn't agree more. I'm gonna have to sidebar with you at some point because it's knowing what to look for is one thing. Asking the questions that can identify like whether they are that or not that is a whole different thing, a whole different category. And it seems like you've, kind of mastered that in terms of not only what to look for, but how to ask the questions to identify if they have those skills, or
Yeah,
not.
and one other quick tidbit I'd give you, Norm, is have them pitch you. Give them your pitch deck,
Hmm.
and then walk them through it, and then have them pitch you your solution, right? And see
Yeah.
how they do it. See how they
I have a
frame it.
bunch of clients who do that.
What spin do they put on it? Because at the end of the day, it's the same solution, but how you convey it. Again, I had 6 people at CM. You heard each one of those six. It was the same solution, but it could come across quite differently depending on the individual.
Yep.
And one of the best there was the best storyteller I've ever met in my career, and the emotion evoked there, leaving the room, was incredible.
I know it's like picking, your favorite child. Are you willing to share who that person is?
Oh, they were all great. I got to
All
stick with them
right.
all. They're all great.
All right. All right. We don't want to upset any of them. So fair enough. I guess that person probably knows who they are. Um, Either way, I'd love to get your advice as a sales leader, myself being a sales leader,
Yep.
meet so many folks on a daily basis who tell me, hey, I eventually want to become a sales leader, or hey, I was just promoted recently to be sales leader. What advice would you give a newer, sales leader in their first handful of years of starting to manage?
Yeah, I believe in a subservient leadership style.
Hmm.
So it's about them, not about you. That would be point one that I would strongly communicate. Give them rope, right? These are trained professionals. These are
Yeah.
adults. Give them rope until they demonstrate they haven't earned that rope, and then you have to pull them back and figure out what's going on. But give them the latitude to go make things happen.
Hmm.
Be there, right? There's problems that are going to be confronted. So as a leader, you're there to help with any sales deal or internal, right? Exceptions that need to be managed. The other thing as a sales leader is I think this is really critical, and a lot of the sales leaders may not think about this, but you are the bridge back to the organization, to the chief financial officer, to the chief operating officer, to the CTO, right? And
Hmm.
making sure that there's alignment with everything you're articulating, representing in the market, back to all those key constituents. Because guess what? There's going to be times when our prospects, it happens all the time, every day,
Hmm.
they want something a little bit different that's
Yeah.
quote unquote out of scope, or maybe it's a little custom. And I think you as a sales leader need to be there and understand the implications of that, communicate it internally, get buy-in internally, and then figure out how can you scale from that, right?
Hmm.
Because obviously you can't do a lot of one-offs as a small digital health company because that's really, really hard to scale. But if there's some ideas, we always used to say the best, and we still say this, best ideas come from the market, from the
Yeah.
employers, right? And so when we hear those, how can we meet that demand and then scale from it, right? And embed it in our core solution. So again, those are all the different things. And then the other thing that I think is really critical is some of the best sales leaders, final thing I'll mention is never disappear.
Yeah.
Never disappear. So you may have your senior vice president of client success. Make sure you're there through implementation. Make sure that you're there at the first annual review. Everything that we talked about during the sales process, did it come to fruition?
Hmm.
We exceed some things that we fall short. Help me understand. So number one, we can correct it and not let it happen again. Again, oftentimes once the hunt's over, people move on. And I think being there and making sure that retention is solid and
Hmm.
you're exceeding the expectations you set on the front line is so important to future growth.
How do you motivate senior veteran salespeople? It's sometimes difficult if someone's been selling 15, 20, 25 years
Yeah.
where they're like, hey, leave me alone. I know what I'm doing. Or, you don't need to worry about me. I'm autonomous. Leave me be. Leave me on my island. Like, how do you because a lot of the people you recruited, you said like between 6 of them had 150 years of benefits
Yep.
experience. How do you motivate a veteran senior team?
Yeah. So my approach was pretty simple. I call them all intrapreneurs, right?
Yeah.
They're running their own business within the structure of the walls. In this case, it was consumer medical. And so treat them as such, right? And we started every year with we'd have our company meeting out in the Northeast in Newport, Rhode Island, and each individual would have to put together a business plan for the year.
Mm-hmm.
And I did not dictate a format. I just said, put together your business plan and then come meet with me and the executive leadership team. And as part of that business plan, articulate how you're going to achieve this goal, $3 million in ARR, let's just say, and then come with the 5 things you need from the organization,
Yeah.
right? Because, hey, we're not perfect. There's no digital health organization out there that's perfect. And conveying what you all need to be successful is so important, because then we start seeing common themes. We can maybe shift some of the investment dollars there. But really, what I'm describing right there in response to your question, Norm, is treat them as leaders and
Yeah.
professionals that they are. And again, give them that latitude. And then, quite frankly, hold them accountable.
Yep.
What I always like to do is um, I didn't have to do one-on-ones because I'd talk to each of them every week. That was the
Mm-hmm.
advantage of having a smaller team, but very informal discussions to make sure they were getting what they needed. And quite frankly, ask, can I come out and be in the field with you? That's my job, right? To support you. So I think a lot of it is just treating them like the professionals that they are and giving them that latitude to be successful.
Well, it worked. And two, you're preparing them for their next job. Look,
Yep.
there's a reason for the 6 or CCOs right now. The reason being is you got them ready for that. You kind of prepared them. You had higher expectations of them than just, hey, your typical salesperson. And they rose to that occasion, which is, fantastic. How do you create a really great culture with a high performing team? Because top performers, they can be divas, they can be territorial, they can want to be the number one rep, and there's a lot of competitive juices flowing and a lot
Yep.
of egos that kind of go into top performers. So like, how do you balance that and create a great culture?
Yeah, and believe me, we had our fisticuffs internally, right? That happens at every organization. But you know what I let them do is air it out in front of everyone, right?
Yeah.
And when it came to me, he said, she said type things, let's get on the phone together, let's talk it out, right? Very, very simple.
Yeah.
Because you're right, people aren't going to get along all the time, but airing it out in a very transparent fashion, in a respectful transparent fashion,
Mhm.
leads to the culture that we had was so critical. Because as soon as you get people going behind other people's back, then you're allowing that to happen, you're perpetuating something that's going to make the culture go south pretty quick.
Yep.
So that's what I did, is I just tried to air it out if and when those things came to fruition. And quite frankly, what I found, and in fact, when the pandemic hit, yeah, I realized we were in the heart of the growth of CM at the height of or at the beginning and the height of the pandemic. And you had people that were on the road every week. And now they
Hmm.
were behind these screens like you and I are doing right now. And so we created weekly huddles. And then we did weekly happy hours. We'd bring the team together in that virtual environment. And what I was so proud of, and I think what the best testament, I talked a lot about culture on our time together here,
Hmm.
Norm, is post CM now. There's a pretty significant text chain of this team and others that are a part of the team that's going live, still going strong. And we
I love.
exited October 1st of 21. Again, it speaks back to we really were a team. There's really mutual respect. And most importantly, we were friends. And
Mhm.
we're still friends to this day, which is pretty cool.
That's heartwarming. I really love a lot of people on that team, and it was not only a talented group, but a group of really really good people. Is it public how much you guys sold for to Alight, or is that confidential?
Now, I don't know if that's public. So
All
let's
right,
just
we're
say,
not trying to break any news on this podcast, so Just want to bring context to what your team accomplished. I'm sure it was a big number, and it was obviously seen as a major success. And I would say, just from a culture standpoint, you built a hell of a culture, and I learned that before we really even knew each other. But as it is my job, it's to know the best people, to try to
Yep.
get the best people to my clients, which Consumer Medical was not one of them at the time, or wasn't. So I can say this, you had some great people. We tried our darndest to convince them that there was some other companies maybe worth a look. And in a very respectful way, they told me and my team to pound salt. Hey, I'm happy, I'm doing well, I love my boss, I love my team leader. So whatever you're doing, it was right, because I couldn't get anyone at your company to consider anything else, no matter how juicy it was.
Well, thanks for sharing that, because I think I didn't really know that, but it's good to know we were doing something right there. So
Yeah, you're doing great stuff. So I ask everyone on this podcast, a ton for the first, 50 minutes on, the digital health market and their experience, and, all that our listeners can learn. But then we want to get you to know you personally and kind of
Mhm.
understand, how you participate in wellness and health. So when it comes to, how what's your exercise routine? What do you do to, kind of decompress and de-stress? How do you kind of practice what you preach?
Yeah, it's interesting because running a company, running around the country, and then trying to get it sold is a quite a stressful environment.
Yep.
And most folks, you may not even know this, Norm, but from August 1st of last year till today, I'm down about 30 pounds, and a lot of it been I'd let it go. I wasn't practicing what I was preaching, so I went through this whole well-being. Um, Applied a lot of different things, and I wasn't going to do a diet because I don't think those work. So what I
Hmm.
did was did a combination of eliminated wine and beer to start with. So I don't do that
Hmm.
anymore. Now I do other forms of alcohol, to be clear. Um,
Hmm.
but I did that. I went on an exercise regime that included 2 days of lifting, 2 days of cycle, 2 days of running. So 6 days a week, I'm doing something, even if it's only half
Okay.
hour. Gets endorphins going at 5:30, 6 a.m. And then the third component I did, the third and the fourth, the third component is I've done some intermittent fasting
Hmm.
where I do the 16 hours from 7 at night till 11 the next morning, where just not eating, doing the intermittent fasting. And then finally, just healthier eating, being
Hmm.
very cognizant. I'm over 50 now, so I have to be careful what I'm putting in my mouth. And so just trying to be a lot healthier. I'm not perfect, but
Yep.
trying to combine all those things. And then what I do for um, kind of the mental side of it is I'm a huge golfer. And when I go
Yep.
golfing, I put my phone in my bag and I turn it off,
I
because
love
that's
it.
my serenity. That's kind of my mental well being. That is 4 hours of my time. I'm going to have fun. I'm not saving lives, and I'm going to have fun. And just put that phone away, because I think at times, these things are intended to connect people. Sometimes we're too connected.
Yeah.
So, kind of from that mental well being, I just put it away and use those 4 hours for manning time.
Well, if you ever in Cleveland, I'd love to take you out golfing, and we'll both put our phones away. We'll enjoy the nature. We'll relax. We'll have some fun. But that's great. No, really, really great to hear. When you say like healthier eating, like what are kind of your guiding principles?
Yeah. So, I was a big fried foods, unfortunately,
They
and
do taste
pizza
good.
and pizza. So, I do a lot of salads now,
Okay.
sandwiches, um, more homemade cooking, salmon on the grill. Now that I'm not on the road all the time,
Yep.
that I'm able to, my wife's a lovely cook, and I'm able to eat her great cooking and then do my own cooking on the grill.
Yeah.
So it's just a combination of just being smarter about what I eat. And guess what? That food tastes pretty darn good.
Yeah, it does. It really does. Any favorite healthy recipes that are go-tos in the Menendez household?
Yeah, there's one that my wife Catherine put me on to, and it's a summer salad with a vinaigrette where it's just salad, tomatoes, cucumbers, radishes, garbanzo beans, avocado, all tossed together. And
Hmm.
Wonderful. Throw a
Good.
little grilled chicken on there, and it's a meal.
I love it. All right. Well, Manny, thank you so much for spending time with us. I think you gave some really, really valuable insights and great advice, to whether it be founders of companies or, salespeople at these companies. I think, some of that advice is, sage wisdom. And thank you for stepping into the ring with me. And appreciate all the listeners for listening to the Digital Health Heavyweights podcast with our guest, Manny Menendez, and host, Norm Volsky. So thank you so much. And have a good one. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.